Welcome back to another episode of Tech Talk 360. Today we have a very special kind of episode. You can see we have two guests, and one of them is Angelo Pereira, the co-founder and CEO at BCAN, and also is part in Next Gen Health Tech and MedTech Solutions, and also a biomedical engineer. Hi Angelo.
Hi, sir.
Thank you. And next up we have Mihri Alvis, who's a biomedical engineer and also an inventor and entrepreneur, also a co-founder at BCAN. So both of them are co-founders at the same space. So who is Angelo Pereira?
So Angelo Pereira is as was explained, biomedical engineer and an inventor and an innovator who is interested in the health tech and medtech space. So I'm mostly interested in projects where I'm taking AI, artificial intelligence, and combining it with medical and health tech products to bring a more productive output.
So when it comes to me, I'm a person who loves challenges, I would say. So I'm not the person who more into academics, but into sports and extracurricular activities. And I had this urge of helping people through technology from the start of my higher education. So that's why I chose biomedical engineering as my higher studies. And now with BCAN, I can, as an entrepreneur, I can give something to the world where I and my team can help out the people in the world to live a better life. So that's me.
Such inspiration out there.
Here is a man who imagined machines that could think. Today, we push the boundaries of artificial intelligence, creating solutions that shape the world of tomorrow.
So first up, I'll show that Angelo. So actually, what is the relationship between AI and medicine and what's medtech? What is this all about? Is it something, so I'll just say my personal opinion, it's something that's going to be really productive and efficient in the coming years, and it's something really interesting as well. I hope it doesn't boost the shock of doctors, but yeah, other than that, yeah, what do you say about the whole collab with technology and medicine and stuff?
Yeah, try to answer that. Definitely, we can't replace doctors. But with AI, so the recent example that I can give is Pfizer. So Pfizer came up with this COVID vaccination in a very short time because of AI. Back in the days when we were starting engineering at the university, AI was the future, but AI is now, that's not enough, right? It's the present. With that, there are a lot of limitations in terms of the data sets. So when it takes medical and health tech products, the biggest issue is the data set or the amount of people that they have to try out before executing the product or even a medicine. But with AI, for AI to work, there needs to be a bigger data set, yes. But the capacity a person understands versus the capacity an AI model understands is very different. So with AI, a lot of limitations have been covered, and a lot of products have been taken into the market with AI because of their efficiency and accuracy.
What do you say about the accuracy? Is it like close to 100%, or is there some quite a patterns?
There's definitely errors. So I don't think any product is 100% accurate. At least about 98% accuracy. 95 upwards is always a better accuracy level.
And I compliment you. So, what is the story behind BCAN and where did the journey began?
Yes, so BCAN is not something that evolved overnight. So it's hard work for about 3 years now, more than 3 years I would say. So we started it small, like a small group with myself, Angelo, and there are amazing individuals, Tarusha and Saundu with us. So 4 of us got together as friends who would like to give something out to the world. So we started with this project and we got awarded as well for this project as a prototype in brainstorm competition at Moratuwa, organized by Moratuwa University. So after that, we had this inspiration of doing something new to the world, giving something out, so that people can live a better life by detecting the breast cancer at the earlier stages. So we developed this project to detect the breast cancer at the earlier stages, so they can they can have a relief for themselves and the family members, though they don't need to be, they don't need to live their life in a misery, so that they can find out the breast cancer at the earliest stages and have a chance to improve their quality of life and increase the survival rate. So that's what inspired us to start this BCAN Solutions. That's our story.
That's quite a great initiative. In fact, Anjali, do you want to add something to that?
I think we can cover it all. So I would just need to give a small shout out to all.
Yeah. It's not an easy journey.
Not at all. So there were a lot of people, from university side, all the supervisors, and there are a couple of advisors who work with us, the oncologists, specialists who work with us. So with all those advisors and experts' comments, only BCAN was founded. Yeah, that's our story.
So if I just go a bit deep into it, what is that? You mentioned about the impact and all that, but what is this product all about? Like, if we just step out of a bit in terms of the consumer's perspective, or like someone who's using it, what is that different? I'm pretty sure not the entire thing, but if you just give an insight on how the journey is and some challenges that you have faced on the developing the product.
Okay, to answer the first half of the question, so why we are coming out with this product? So it's about breast cancer, right? So breast cancer is the highest incident cancer of all the cancers in the world. So its death rate is about 600,000 deaths per year. So 1 in 8 women gets breast cancer. So it's quite a high number. There's one person dying every 45 minutes. Because of breast cancer, this is global statistics. So breast cancer is a very devastating disease because one thing, people doesn't have that awareness to detect it at the early stages. So even though they have awareness, the issue is this. So to detect breast cancer at the earliest stages, the general protocol is for clinical breast exams or self-breast exams. So in clinical, they have to visit to a clinic and get the oncologist or the breast surgeons to do physical checkup. That's the only thing that helps people to diagnose breast cancer. Apart from that, it's mammography, which is the golden standard. The main issue with self-breast exam and clinical breast exam is that if you have a breast cancer, it takes a long period of time to develop it. And you wouldn't even know that you have a breast cancer. And once you get the pain only, or alarm, you will feel it. But at that time, the breast cancer has been developed to a level that you had to remove your breast. You had to do a mastectomy or a mastectomy. So that's an issue. People doesn't have a way to identify it in the early stages. And when it comes to mammography, we spoke to a lot of patients. We went to the Colombo with the breast clinic, KDU, where I had a breast clinic. We spoke to patients. What everyone said was it was really painful and they would never do it again unless they had to do it according to the oncologist. It was really painful, the mammography. But even for a mammography to take lump show, we have these bigger than 3 millimeters in size. That's not exactly early detection. So that's the main issue that we have. And when it comes to the age gaps, the young girls, the biggest issue is that they doesn't have an option to go for mammogram. Well, since their breasts are very small in size, the density is too high for mammogram to detect. So they only can go for self-breast exam or clinical breast exam, but that doesn't help in eye detection. So we are trying to bring out a solution to answer that question, how a young girl can detect breast cancer at the earliest stages. So that is why we came up with this project at the initial phases, and right now we're heading to answer that question as well.
So adding to that, so recent studies have shown that 20 plus years of age women has a higher percentage of getting breast cancer rather than like up until now, it's mammogram is recommended for women above 45 years of age. But now it's becoming a case in the age gap of 20 to 45 years also. So these people, as Angelo already mentioned, has higher density in their breast, and so they will be getting accurate results from mammogram. So that's why we stepped into this problem and tried to figure out a way for them to self-breast exam, to make it the self-breast exam more easier and like to do it at their home with the comfort of their home. So they don't have to expose themselves for the mammogram, or they don't have to go for the checkups. They like, so in WHO, it is said that every girl above 20 years should do self-breast exams, so to detect breast cancer at the earliest stages. But question yourself, girls, do you do it now? No, right? Even I didn't know that we were supposed to do after we become 20 years of age. So that's a huge problem. But if we have a product at our home to do it for us, like with a couple of seconds or very easily, it would be a huge help for us, so that we can detect it early and get help from the doctors. Yeah.
I mean, adding that breast cancer has become a very taboo topic. No one would like to talk about it. It was very hard for me. You asked what are the challenges. So when I went to, I had to do some data collection from several breast cancer patients during the university time. So me being a boy and going and asking them, I had to take the pet and after some of your breast, it was really hard to have an interaction in them. And I've seen like when week 5s usually come and give the awareness to homes, people doesn't even like open the gates, they lock themselves inside, they doesn't want to talk about it, but it's something to talk about because of the higher incidence rate and the death rate.
Is there data for Sri Lanka on how many patients that report every day or something like that? Do you have something to say on that? Or like, are the cases increasing every day, or is there yes?
It's increasing every day. As I recall, the Sri Lankan stats say that there's three deaths per day.
So,
Here of breast cancer.
This visionary gave the gift of literacy to the blind. His invention changed lives then. And we're thrilled to continue on from where he left off.
So if I just ask both of you, I'll just ask. So in terms of, you mentioned about awareness and bringing up a solution. So what do you feel like you are making probably the best, easiest solution? So what are like the factors that you are considering when making the best solution or developing using the newest tech or latest tech like AI? So how does that process is? I don't want you all to tell all the stuff.
Yeah. So when it comes to the solution, the first thing we are looking at is the comfort. So we're actually trying to reduce their travel, and then the travel cost and also the pain from them. We are not trying to replace mammography. It is not what we are trying to do here. But mammogram is still the gold standard. So we are trying to give out a solution where it's much more comfortable. So the comfortability of the other woman wearing is the key thing. And the next thing is the accuracy. So that is where our AI will comes in. So we have seen a lot of products or a lot of patents, I can say, that have tried several techniques to solve this problem, but a lot of them are meet succeed because of the unavailability of AI. So we saw some of the patents from 1980s, 1900s. They have tried this way before, but not having an option to scan that large data set was a barrier. With AI, it's possible for us to do that. So that is where we are coming with a more accurate prediction of breast cancer.
Yeah. So that's about it, I guess.
Okay, so
Let's go further. And
yeah, perfect. I just got to get a small overview on how the whole process is. I'll just step out of BCAN a bit. The new element, just going to ask you some few questions. You just have to answer from one word or one sentence. You can exceed that, but just try to. So I'll ask again from. I'm sorry. Yeah, just. What is the best advice that you could give to someone? It can be the young person, youth, or entrepreneur or business perspective.
That's what scares you. What scares you. That's my thought that I always have in course papers and everything. BCAN is itself a medical product. We are just recent graduates taking a medical product with a lot of regulations and a lot of tests and validations required. I mean, it's a huge risk, but do what scares you.
So, what is the worst advice that you have received so far, and how you okay and you could withdraw?
Worst advice. After all the worst advice has
Everything that you have received is like you take it as good.
Yeah.
Yeah. Okay.
If it's the worst advice, then it wouldn't be stored yet.
Yeah, correct. That's correct. So, if you could go back, flashback to your youth days, small days, if you had a chance to change your career to another aspect, would you like still go ahead with biomedical engineering, or is there
At that time, my initial career goal was to become a pilot. With COVID, the industry went a bit down, and then I started university. And I mean, I went to the university to do engineering, biomedical engineering specifically.
So you had the passion to be a pilot?
At the earliest stage, not right now. That is because biomedical engineering has changed my life. Back 4 years ago, 2020, when I joined the university, biomedical engineering was not on the beats, was not on the top 3.
Okay.
But I saw the opportunity that I can directly help. I mean, all engineers help everyone, but we are directly giving an impact on the health side, and I love to take risks. Biomedical engineering is always that way. I can give a lot of examples from my internship at hospitals. But right now, in my university, medical engineering has come to the top 3. So it's increasing rapidly, and it's very novel field. But Sri Lanka yet, there are not a lot of opportunities. There are not companies that are doing medical device research and development. I can just name only a couple. But when we step outside from Sri Lanka, the industry is messing. It is present. So we never checked it out.
Perfect. What is the best advice that you have received so far? You can link it to any aspect you want.
So it's never give up. So I received this from my father actually. So always what he said was never give up on your dreams, right? So if you have something in your mind, back of your mind, something would always tell you to follow that passion and never give up. So you might get lots of challenges, obstacles, barriers through your way, but never give up when you start doing that. So even BCAN Solutions has so much of challenges these days since it's still in the startup phase. But not giving up, I know that this will be a successful project and success will come in one day. So that's the.
So if I just ask, the worst advice that you have got so far, did you prove it wrong, or have you received any worst advice, or is it like actually?
So worst advice I would say is to stay till you are perfect. You are never perfect at any point. So with what you have to start something. then only you will be perfect, right? So there's no point where you are perfect at a point. So always there's something to learn, something to improve in yourself. Even though you reach a goal, there's something more to reach, right? So never stay until you are perfect to start something. Just start it.
That's something I drive as well. There's something just starting that day itself.
Yeah.
And if you have to go back, flashback to your young days, will you change your career or will you be still in the same place?
No, I would say no.
You had the biomedical.
Yes,
degree.
I had the dream. I had the dream of becoming biomedical engineer, and in the beginning also, I was the one of people who had the end goal of becoming a biomedical engineer when I joined the university.
Oh, yeah.
Yes, and I'm from there. So I'm happy about myself, and I'm happy about the things that I failed and the things that I've learned. Yeah, definitely.
Perfect. So that's this one question that's been driving through every episode is that we are as youth as well, and there are more youth who doesn't know what they want to do, and that is one reason why I made this podcast, is to explore new opportunities and stuff like that. So if there's one message or anything that you can give to someone who's pursuing in biomedical, who want to do a problem and solution like what do you have to say? I know like we gave the advice to start it, but so let's go deep. Like what is the thing that you want to share? Okay.
He spent his career inventing the tools, toys, software, and projects that popularized the view of computers as incubators of knowledge. We carry his torch, inspiring the next generation of innovators through innovative learning experiences.
Okay, so this is purely my personal opinion. This might not really accept me, but I would say, with my personal opinion, a lot of undergraduates do marvelous final year projects. But as soon as they step outside the university, they keep that project out at home, inside their home, and then go to a job, and then get themselves stuck there from 8 to 5, and then come back home, sleep, and repeat. So their final year project lies there. They might have spent a whole year, might have collected data, they might have spent money, they might have received experts advice and consultations, but everything is out there just waiting. So the other thing is most undergraduates are being pushed to write papers and publish articles, do a publication of a final year project, put it out there. If I put my final year project publication out, then this company is nothing. So I have about 3 to 4 publications on my laptop waiting to be published. But since we are right now moving towards a patent, I have kept them until that time. So my advice is, if you think a project is worth, and if you are not scared, if you want to take a risk, you take it. After the university, the first year is very crucial for an engineer because the resume, you can't have a big gap. So use that time period. If you think you have a product, take it to a start. That would first benefit you, second benefit the country. Right now we are at the economic crisis, we are blaming everyone, but as engineers I can say that more startups bring more investment. So even BCAN, we are trying to these days fundraising. We are going for investment seeking, so we are planning to bring a large portion of foreign investment into the country. So there are about my university 90 students, so about more than 50 projects. So I would say at least about 20 startups would
Come back to the economy.
I haven't won the startup game. I'm still started it. We are still learning a lot from the startup game. But if a lot of people comes out with startups, I think it's good for both that and the country.
So for me, I would say believe in yourself. That's the most important thing that an entrepreneur, a person can have. Believe in yourself that you can do something. And also, as I said, never give up on your dreams. So if I didn't believe in me, if I didn't believe in our team, BCAN Solution would not be here today. So BCAN Solution is something, it's still in the process of improving, progressing, but still believe in what you do, believe in what your thoughts are. And that will make you successful one day. You know.
Perfect. So also before I finish off, I know there's a great number of individuals behind the whole project. So just giving you the opportunity, if there's anyone you want to thank or you want to give a shout out to, this is your chance. You know, I know this is a hard project.
Yes.
Yes. So if I say all the names, I mean, I might definitely miss a few, and there's a huge number of people who helped us, but I'd say that recently people who are engaged with us directly, I want to say that Dr. Angelo Panaratna is coming in as the Chief Strategic Advisor. And we have Dr. Kanchana Vijay Singha. She's a breast surgeon in Colombo with a GST hospital, and she's our medical advisor. And then we have Mr. Didankar Konasota. He's our business strategy advisor. And he's a CEO in a startup. It was a startup, and then he has come out of the startup into a successful company named Pedalis. So he's the CEO and co-founder there. So these three are the main pillars behind the BCAN right now.
And there's more, I'm pretty sure.
Yes, there are a lot. So
coming back from the university.
Yes, so much. And also, we should thank that our parents are tolerating us right now. Like, we got the engineering degree, but still we are like going to start a startup, right? So at this moment, we don't have any investments. We are taking a huge risk. We are pocketing out our money and giving up everything to this project, right? So our parents are tolerating us. Everyone, our friends, everyone is tolerating us, and so that they are a huge support for us also.
Finally, thank you so much, Angelo and Nini, coming to the podcast. I'm pretty sure this is some exceptional content. I'm really proud to have you all here and speak about this project. And I'm hoping you guys will come back next year. I have thousands of questions to ask. I can ask everything on that episode. And wish you both a very successful career and everything with the project. All the best. As it is your first podcast, you can share your thoughts right now as well.
Yes, first of all, thank you, Russell, and the team behind this. Even though you guys can see there's a lot of people behind this, so it's great work. So I watched your episodes a lot. Thank you so much for inviting us, and keep doing this and never stop. This is something very interesting and something that's needed for this country.
I first invited Angelo. I didn't know you were doing this and we have no behind this. But thank you so much for accepting the invitation, and we'll see you again soon.
Yes.
All the best.